this is from studying.
Yeah.
Probably. Yeah, because look, your shoulders just want to slump like that. Does it hurt when I go backwards like that? Does that hurt your mid-back?
Like a little right here.
Under your clavicle?
Yeah.
So when I go like that, that hurts.
Yeah.
I know
like
I'm
a
pushing
little
there,
tightness
but
right here.
you feel it.
Yeah.
Okay. Do you have pain in your neck?
It's just like soreness.
But you're saying this is your main complaint. It's your arm is going numb.
Yeah.
What my theory is, she's saying she's a stomach sleeper. She sleeps with her head turned to the right. And even though when she turns her head to the right now, she doesn't feel anything. If for prolonged period, do you sleep with this arm up over your head?
I sleep with my hands like under my hips.
Okay, and that
and my head to the right.
Well, that might be why your shoulders are this way then.
That might be too, yeah.
Yeah, because your shoulders should be like this. If you're sleeping like that with your hands, oh my God!
Yeah.
All right.
But my mom said that I've been doing that like ever since I was a baby.
Yeah. Oh no, that's gonna be a really hard habit to break. But it's easier for you. Oh, I'm sorry. For her to go this way and sleep that way because I have a prediction that her atlas is shifted to the right, so it just feels more natural to go this way. Now, when you turn your head to the left, does it feel?
It's like strained more than.
Yeah, it doesn't feel very comfortable doing that. And then going this way,
more like free.
Right. So by the end of this, I want it to feel free, as free as we can get it, going this way. All right. This here, the only way that we're going to be able to correct this permanently is through stretching.
Okay.
So that's something I have to go over at the end of this. It should feel, I don't want that pulling feeling in here, but the goal of today's treatment by the end of this is to get you to stand up straight and it not be uncomfortable.
Okay.
Because a lot of people go, I want to stand straight, but it hurts. So I want this to feel comfortable.
Okay.
It will get you going so that you can do your exercises at home and you can keep this. Okay, but if you sleep for 8 hours with your head like that, what am I going to do?
I try to stop sometimes, but then,
on your back, face up. It's hard because what happens is when people they'll try to go to their backs, right? And then they end up saying to me, well, the only way I can get comfortable is with my head turned to the right and my arm over. I'm like, oh no. All right, and she says that the only person that's been able to crack her neck is a DO. And she's still saying she just feels stuck going the one way. It's not that bad. But are you feeling more soreness over here?
Yeah.
When I'm pushing on the suboccipital muscles on the right, and she's going, ugh. And then I go over here to the left. Well, I don't know. Is that tender?
Not as tender as the other side.
Then, here's my favorite one up in here. Yeah. And she's like, yeah, because it's just compensation. If I go same place, right onto the occiput over here, is it a sore?
No.
So she's just a classic case. Atlas is shifted to the right, and when the atlas shifts, the occiput kind of goes the other way. So then you'll have strain over here, strain up here on the suboccipital region, and strain down here on the atlas. Very common, nothing out of the ordinary. When people have like 2 or 3 segments, like on the same side up high, like if the occiput C1 and C2 are all out on the same side, that's more of a severe case in my opinion. And I find that usually with people that self-adjust, but not with you. So you must be doing okay. When you adjust yourself. Trying to give this neck a path for this to drain. Coming from the outside, lateral to medial. Got to drain that down. Come back here and drain it. Doing okay? You let me know, okay? Okay. Is it easing up at all?
Yeah.
they're smaller than the width of my finger tip. And I grab onto the base of the occiput and pull up. I want to pull that attachment back up onto the skull. Just like that. Just so. I like that. Sit there and work on these. Here's another one. You know, sometimes you might feel it up into your eyeball.
Yeah.
But as soon as I stop, it should go away.
Mm-hmm.
And we take the atlas, see what the atlas wants to do. It's got plenty of wiggle room. Yeah, we're not going to have any problem going this way. Now let's go to the right-hand side. Oh, man. Crunchy over here.
Yeah.
This is scarred. And she's saying she used to cheer, and she's had girls fall on top of her head, right?
Mm-hmm.
Dear Lord. And you were pointing to this side. When
Yeah.
You're like, yeah, when your patient's saying, she fell on me, and they'll point to where they remember feeling it. And you were subconsciously saying right side. Yeah, look at that. That's scar tissue. So she's got scar tissue from here. Oh, man. All of that. Feel these little pebbles? 1,
Yeah.
2, 3, 4, 5. The whole way down. It's been crumpled. It's been like an accordion. Oh, my goodness. Okay. I'm going to have to go through one at a time. Ooh, that might be a little uncomfortable. Shake, 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 shake. That's where all the fluid is lying in there. That's a lot of pressure. I'm sorry. We'll give it a break. Let's go to C2, C3. C3, C4. Scrape that on down to C5, C6. Oh, man. So you never know what you're going to find. I thought for sure the left was going to be worse on the bottom of your neck.
Mm-hmm.
No, but this is bad the whole way down. There it goes. Let go. It's not like it can't let go. But this is the kind of thing for the scraper.
Mm-hmm.
All right. It's let go, though. Okay, that tension let go. So now I'm going to try to adjust it. I'm going to go right at the tippy top. It needs it so badly. Right here. Relax here. There you go. That was easy.
Yeah.
That wasn't bad. All right. Perfect. Now, with this one, I'm not going to do as much rotation. We're going to come up. I'm going to take her back this way because there's a little, usually you have to park in the back piece. The other side of the atlas, we got to go this way. So it's like straight back. Right here. Right there. Okay. So I don't want to rotate it into misalignment. So we just go up.
That was like, because I can never get that side, so.
Is it
Felt
okay?
really good, yeah.
Okay. Oh, it really like.
Yeah.
That's it right there. That's the one. So we're gonna have to do some exercises for the neck.
Okay.
We're gonna do them in a little bit. I just wanted to kind of stay there, let the rest of that drain. Okay, we're gonna do the toes.
Okay.
The real reason why we do the toes is this tells me a lot about your posture. Oh, which toe is more looser than the other? They all have different flexibilities. Yeah, it's information, and it does no harm to adjust the toes. Yay! Do you crack them?
Yeah, sometimes.
But they feel like healthy. They don't feel like you've over-cracked them.
Oh yeah, I try to not crack them all the time.
Okay.
Mostly my neck.
Uh-huh. Even your neck wasn't too bad.
My dad used to crack my toes when I was a kid all the time.
You pull them?
Yeah.
Oh, that that moved just fine. Don't need to pull more. Ooh, now this one. See how that, yeah, that one doesn't want to quite go the way I want it to. All right, hands over your head and grab the table. Yep, there you go. No, oh, feels good. I'm gonna do the long axis adjustments here. And need to grab on for me. Because here we go. Hip. No problem. And see how this side's a little bit more stuck, you understand?
Mm-hmm.
There it goes. Just had to use my foot and brace myself and pull harder on the, so, but they still, both of them went just fine. It's an odd feeling, it just goes.
Mm-hmm.
Classic pant seams are off to the right. Leg checks. We have the same thing as what we saw yesterday, Linnea. 80% of the population, don't feel bad, okay? We have a left short leg that goes long. We have a left PI ilium. Let's see which way the sacrum goes. You're gonna lift this leg up straight up in the air. Woo, and down. And the other leg. And not so much, huh? Feel a little bit more stuck on the left?
Mm-hmm.
Okay. And all that tells us is which way the sacrum's pointing. You have restriction though, here. There we go. Yeah, it looks like you're turning red, but you're very fair.
Oh yeah.
So the petechiae is what doesn't go away. That takes like 4 days to go away. It does go away, but not instantly. The redness goes away within a few minutes, but the petechiae takes a couple days.
I feel that like all the way down like here.
Okay. Is it pain?
No, it just is like just on that side. It's like
The
tight.
right side?
Yeah.
Yeah, I told you were kind of swollen there. So as I run over these knots, if you will, it really just places where there's edema, like right here, you're gonna feel it
Other
refer
places,
pain
yeah.
or discomfort into other places. It just means we have a problem here. It should ease up, but it might not. Depends on how fast your body can drain that. So at this point, what I usually do is let's crack it. Okay, that gets rid of a lot of the edema, the adjustment.
Mm-hmm.
Right, and deep breath in, all the way out. Perfect. And again. And out. And out. We're a little tight down there, okay? It's all right. Do T1 on the right. T1 and whatever ones want to follow. Here we go. Deep breath in. And out. Okay, it's a little stuck there. That one, yes. She had one that was out on the right. Yeah, and she has a knot. Superior aspect of her ilium here. Very common. The hamstrings aren't bad. You were mentioning why your ankles crack. You gotta work on these right here. That is why they crack.
Yeah.
Check this side. No scar tissue here. Little tiny bit at the base of the sacrum. Very common for there to be a trigger point in the superior aspect of the left sacrum and the inferior aspect on the right side of the sacrum. This one is usually easier to get rid of than the huge one up at the top. This allows me to get a better low back adjustment, or pelvic, I guess, adjustment. SI joint. And we're going to do the calf on this side. Yay!
I get really bad Charlie horses in my foot, right there.
Oh, man.
Like the arch of my foot.
Oh. Yeah, you have to relax these calves. It's just a muscle that's prone to it. you doing okay?
Yep.
I'm really pressing on this thing. Okay. That needs the adjustment now. All right, I'm going to go back to where we were.
Okay.
Hopefully it's eased up a little bit.
Yeah, I don't feel it anymore.
Perfect. All right. I'm trying to figure. You must have worn a strap
Yeah.
that was just one-sided.
Oh, actually, I don't even know how that happened.
You have to look at the skin.
Mm-hmm.
The skin tells you a lot. I've heard horror stories from other physicians who never took the time out to actually look at the skin underneath what they were working on. And in the state of Florida, you need to, with the sun, or UV like it is, you need to learn how to examine the skin. And here's this curve over here. So we're going to get to work. This is where I go in here and fine tune everything. Other side. So it feeds all the way down into here. All this scar tissue. Oh man. Okay, we gotta get you like a massage cane. I have a video on that. You gotta come in here underneath the scapula on the right and get all of this. You take your cane and you just grab onto this and drag up. And drag up with the hook. How many times have you been injured that way where somebody fell on your head like that?
Probably a few, like 5.
Okay, so and it was all the same way, same. So an impact from up top and crunching this whole system down like that has caused scar tissue, and it's kind of just contracted this whole side. I saw when you were sitting there, you just really were leaning, and that's why it feels like you can't lower the shoulder down. Is that what you were saying?
Yeah.
I mean, I'm gonna get it and it'll feel better, but I don't want in 2 weeks to go. You're gonna be like, I went right back. It's because you have quite a bit of scar tissue here that you're gonna have to work on it daily to keep that relaxed. See that? The other side. Put your other arm behind your back. Look at see how this separates just nicely. It's nice and smooth. Yeah, your ribs are there, and I'm going over the ribs. But now at this side, oh. All right, so both arms down for me. That just that happened to you. Life on Earth is it's hard. It's hard. I was kicked in the head, and I heard every bone in my neck crack when I was in Taekwondo. I was never right since then. It only took once for that to crack. And I tore my tendons and ligaments, and I battle that every day. And I think parents need to be made aware of what these high-impact sports can do. And the coaches need to be trained, the masters need to be trained to not put people in danger like that. But, I don't know, that's part of the sport. That's part of what it is.
That's exactly why my mom was like, you need to do a non-contact sport.
Can we do swimming?
Yeah.
Can we do something else? Ugh. unless you miss your flip turn. I guess that's the only way you could really injure yourself in swimming. There we go. All right, we are done with this. Oh man. Yeah, I thought, you know. Okay, here's this right shoulder. It's really swollen. So I imagine there might be some petechiae here, and it looks like there's some coming out already. And I always ask because people want to know, does it hurt?
No.
I have to come back to that one. Not too much. Even with all the scar, okay. There it comes. There's that scar tissue I felt right here. It really just kind of got crushed over here. It's leading down into the traps. That's all I'm gonna get.
It's so crazy, like the difference on it.
From side to side. Yeah, tuck your chin a little bit more. I could try to go a little deeper on this side. It's at a deeper level than the other side. I can maybe get some on this side too. So you feel the difference between this and the other side.
Mm-hmm.
I mean, you do have, it's at different levels on this side. So not as sore on the left-hand side.
Yeah.
I'm just combing through that fascia, getting blood flow circulating to these tissues. Kind of pulling at this scar tissue, trying to make it more smooth it out. I don't think that's all I'm gonna get. Is that sore there?
Yeah.
You see that? Yeah, I missed that. Ooh. Yeah, I missed this whole section. Ooh, okay, there it goes, there it goes. All right. Okay, gotta go a different direction now. Lat is cleaned. Let's get the infraspinatus. Infraspinatus goes this way. Okay, done with that. Now low back. Go up here. There's usually not much on this section, but I always check. You never know. Doesn't harm anything to check. Well, this is where I felt. Do like a tissue bowl here, see if I can get anything else deeper. I mean, I am digging on you here. Are you doing okay?
Mm-hmm.
I'm almost done with it. That's all I'm gonna get. Ugh, I gotta call it quits. Okay, this should feel a little cold. All right, how are you feeling, at least in here?
Better. It doesn't feel like there's
Catching anymore? I'm gonna do this test. Head back, head chin to back, yeah. I'm gonna really take it back. I don't feel anything catching.
Yeah, no.
Okay. Lean back for me. Relax, I got you. You got it. Perfect. Other side. Oh my goodness. Okay, just wanted to make sure. That's like, maybe there's one more. Do you feel it catching over here on this bottom side at all? Nope, it's in. Okay, stay there. Good times right here. Here is the compensation for that quad.
Yeah.
Yes, I feel that. It's the tensor fascial lata. Gotta get it. You got a little bit of homework to do. You got quad on this side.
Mm-hmm. And my calves.
And your calves. You can stretch them out. You can foam roll them out. Do whatever method gets you the results you need. You're responding pretty well to rolling.
Mm-hmm.
You know,
Feels good. Like a good pain.
Your muscles are kind of letting go fairly easily with not that much difficulty. You know, it's leading in from this little scar. Remember this over here?
Mm-hmm.
This big knot you have? It's kind of leading into the hip socket here. Okay. How about everything else? Anything
Yeah.
I missed?
Feels good.
Just the ears is the only thing we haven't done.
Yeah, I know my neck feels
Normal.
balanced.
Yeah, okay. Yeah. All right, go ahead and sit down. Lean away. Tilt your head like the opposite. Yeah. Didn't really go. Lean away again. Yep, that was it. That was where the scar was.
Yeah.
Okay. I was like, no, it's not on the inferior aspect of the ear. Maybe it's on the superior aspect. Lean away. Nope, not. Same thing as the other side. This side don't want to go. Nah, it ain't gonna go without me yanking on something. Very good. So definitely the right side
Yeah.
scarred there, and you know,
Just this whole
side.
Yeah.
Yeah. So you know, the way you do is you take your ear like this, and you just kind of gently pull, and make sure that this. I kind of go around the whole ear and make sure it's not. It's got flexibility, and it's when something gets stuck, that's when you worry about it. So even though this side didn't release, it's got plenty of flexibility. It's like, moving around in there, and I'm not worried about it. We've got to open up this chest. This is what we're going to work on. We've got it at this point.
Mm-hmm.
Now we got to keep it this way naturally. So that's what we're going to work on.
Yeah, it doesn't feel as like.
Yeah, if you try to do that without this, you kind of go, I don't want to open up my chest. I don't want to do anything. It hurts. It pulls, right? But if we can get, it's okay. All right. We're done.